Tonight, a local mental health counselor is grateful his patient walked away unharmed from a tense encounter with police. WSCV's Brian Ray is joining us with why the counselor says it is more proof that crisis training is critical for officers.
Well, Tina, Abdul El Amin says he called 911 for his patient to get transported to a psychiatric facility after the man exhibited manic behavior. He says the patient was agitated and pointed a BB gun at officers, but El Amin is praising officers for how they handled the situation.
I got there, the individual was very loud, very agitated, delusional, and so the staff person had already left and said that they were kind of fearful and said that for the first time working, that's the first time that they felt like they might have been in a little danger.
Abdul El Amin, a licensed counselor in Savannah for 4 decades, says he's seen situations like this in the past, but not to this extent, a patient in crisis pointing a weapon at police. El Amin recalls as many as 20 officers arriving on the scene, eventually de-escalating without shooting the patient.
They were very patient with this gentleman to make sure that there was no harm brought to that particular person. I was very impressed that they did not shoot this man. And I'm glad that we were able to get out. He was able to get out this situation alive because it could have gone a lot worse.
The American Psychological Association says at least 20% of police calls involve a mental health crisis, and that number is growing. In 2020, the Savannah Police Department opened a behavioral health unit to better respond to these situations. According to the department, as many as 750 officers are trained in crisis intervention meant to minimize risk and prevent the potential use of force.
For them to have the training is significant, it's important, because they are the first one there to secure it when it gets out of hand. This particular time, the system worked.